Great. So thank you for sharing this case. This is a patient who is presenting with foot pain. And what we're seeing here on the lateral projection is that the posterior fibular positioning is present. When we look at the calcaneo pitch angle, it is not super elevated, but we have tibio-talar degenerative change, talar-navicular degenerative change, and we have an apex of this caval deformity at the level of the Lisfranc joint. Looking at the AP weight-bearing view, we can see that the vector of the talus still points slightly along the first metatarsal, so there's not an exaggeration here, but the shape of the talus has changed, and there's a suggestion of an endorotation occurring here. Obviously, midfoot degenerative change, there's overlap at the midfoot bases, and we have an attempt at varus deformities at the second through fifth MTP. We have hallux MTP, also atypical varus deformity occurring there. And moving into the MRI, we can start to understand a little bit even more of the vector. If this is the fibula and this is the tibia and this is the vector of the leg, we can see that the talar axis is quite rotated relative to this vector. So just the mismatch between the tibia, fibula, vector, and the talus gives us some idea of the biomechanical alterations in this foot. Also, we're seeing quite a bit of the calcaneus here. And when we look at a situation where we drop a bisection of the tibia, we can see that the vector of the calcaneus is to move away in a situation of a hindfoot valgus. So we have this situation of pes cavus with a hindfoot valgus, and that can give us a very exaggerated biomechanical outcome. So when we zoom up on these structures, we can first, if you get a sense of the medial flexor tendons, the posterior tibial, the flexor digin, the flexor hallucis, what we see here is basically quiet chronic tendinosis, mild. The lateral flexor tendons, we're looking at the brevis and the longus, and the brevis we can see spreads out and becomes tendinopathic, split tear, rejoining to form a common tendon intact to the base of fifth, very common in pes cavus pathology. Longus being intact, going along the pulley of the cuboid tunnel. Moving up to the extensors, a little bit of tibialis anterior tenosynovitis. Looking at the region of the syndesmosis, slightly stretched here, posteriorly intact, indigitating, showing its altered biomechanics. ATFL thickened, PTFL mildly sprained, calcaneofibular ligament sprained and mildly thickened with synovitis in this region. The deep deltoid, the superficial deltoid, and the regions of the spring ligament, mildly thickened, not a lot going on. Looking at the Achilles tendon itself, mild tendinosis, thickened here, trace retrocalcaneal bursitis thinned at its insertion. Let's get a better look of that on the axial image where we can see this chronic tendinopathic change in the Achilles. Looking at the bony structures, we're seeing that there is subchondral edema, grade 2 diffuse chondral thinning along the lateral talar dome. We can see that we have the subtalar, posterior subtalar joint, advanced degenerative change along the lateral talar process, which makes sense when we consider the altered biomechanics that are occurring here. Sinus tarsi itself has some obliteration of the fat space here. Let's take a look in here. Some synovitis, some mild preservation. Looking at the plantar fascia, thickened central cord, abductor digiti minimi atrophy. This is a very common finding, especially when you think about the biomechanical strain that is going on the posterior tibial nerve. As we make this valgus, this nerve has to stretch the lateral plantar nerve, which gets to the abductor digiti minimi. So all in all, this is a mixed biomechanic of pes cavus with hindfoot valgus and the advanced degenerative changes that can ensue. One thing I left out for the advanced is that there's likely going to be an extra articular posterior medial talocalcaneal coalition, with it at least acquired with this functional degenerative changes occurring along the anteromedial aspect, which we can see a little bit better over here in this region here. Okay, thank you.